recording. As I stated, it is an important gathering for us in Pharmaceutical Society of Nigeria because this is not the first webinar we are undertaking. We have undertaken several webinars in the past regarding capacity building and public enlightenment. This year's World Cancer Day webinar has 4 or 5 specific objectives. The objective is we aim to educate health professionals amongst us on the platform, nurses, pharmacists, physicians, and all other healthcare professionals on the best practices, innovations, and evidence-based approaches to cancer prevention, diagnosis, and treatment. Another important objective of this webinar is to empower patients and caregivers, whom are also invited into the public discourse, to empower them with information on early detection, treatment options, psychosocial support, and survivorship. Also, we aim to engage the press and general public to amplify awareness, campaigns, dispel myths, and encourage lifestyle changes that reduce cancer risks. We will not conclude this webinar without attempting to promote policy advocacy by highlighting systemic challenges and opportunities for strengthening Nigeria's cancer care infrastructure. Last of our objective in this webinar is to foster collaboration among stakeholders to build a united front against cancer. You will agree with me, even in the choice of the resource persons, you could see a very distinguished oncologist, a physician by training, and a global health expert is the keynote speaker, and another highly respected oncology pharmacist is also the speaker on this platform. This year's theme, United by Unique. In our own context, we adapted it to people-centered approach to cancer care, is especially relevant to our nation, Nigeria. It reminds us that every patient's journey is unique and that our strategies must reflect the diverse cultural, social, and economic realities of our Nigeria. By placing people at the heart of cancer care, we ensure equity, compassion, and dignity for all. Equally important is the spirit of interprofessional collaboration that I have stated. Cancer care is very complex, requiring the expertise of oncologists, nurses, radiologists, pharmacists, psychologists, nutritionists, and social workers working together as one team, together with patient caregivers and the patients themselves. It is only through such collaboration that we can deliver holistic, seamless, and effective care that truly meets the needs of patients and families. As we begin today's discussions, let us be reminded that this webinar is more than an exchange of ideas. It is indeed a call to action. Together, all of us here and those that will listen to the recorded version, united by our unique strength, we can transform cancer care in Nigeria and bring hope to countless lives. At this juncture, I want to recognize in no particular order the presence of very distinguished personalities with us. First among our indefatigable chairman of the Pharmaceutical Society of Nigeria, the amiable pharmacist Salamatu Orakwelu, a fellow of the Postgraduate College of Pharmacists, and merit awardee of the Pharmaceutical Society of Nigeria. You are welcome on board, ma.
Thank you. Thank you.
On this platform, we have other distinguished personalities, both fellows of the Pharmaceutical Society of Nigeria, fellows of the College of Physicians, fellows of College of Surgeons, fellows of the West African Postgraduate College of Pharmacists. We have distinguished awardees, we have merit awardees, we have a lot of personalities from the nursing cadre. I can see Hawa Mustafa Daraka, my sister, and also a board member of the Hajiya Saadiya Cancer Foundation. You are welcome onto this platform. Others, everybody is welcome. Our interns, I can see a lot of our intern pharmacists, our senior colleagues on the platform. Everybody is welcome onto this platform. Without wasting much ado, I will call on our chairman, pharmacist Salamatu Orakwelu, MAW Merit Award winner, fellow of the Postgraduate College of Pharmacists, and a Masters of Health Management to deliver her welcome address and opening remarks. Ma, you have the floor.
Thank you, Dr. Abubakar Baraka. It's always a pleasure listening to you speak. And I think you've made my welcoming or opening remarks very easy. You've actually recognized everybody, distinguished colleagues, partners in healthcare. Ladies and gentlemen, I want to sincerely welcome each and every one of us and to tell you that I am really delighted to welcome you to this impactful webinar that is themed United by a unique people-centered approach to cancer care. The team speaks directly to urgent need for collaboration, just like he stated, equity and compassion in our cancer care system. As we all know and we are aware, cancer is not just a medical condition, but a lifelong experience. The people-centered approach calls on all the healthcare professionals to advocate for timely access to care, affordable medicine, patient education, and policy that will place dignity and quality of life at the heart of cancer management. As pharmacists and health professionals, we must continue to be voices for our patients before diagnosis, during treatment, and beyond. Let me borrow the word of Maya Angelou, which rightly said, people will never forget you for how you made them feel. And in cancer care, how we care is just as important as how we prescribe or dispense medications to our patients. I want to thank the organizers of this webinar from Daraka, words are not enough, for the EXCO and myself to appreciate you, even the branch and your team at a very short notice for putting this webinar together. And I appreciate all participants for standing united in this advocacy. Together we can influence our practice, change policy, ensure that cancer care in Nigeria truly serve the patient or the people it is meant for. We are all welcome to this important webinar, and I wish us a productive and impactful section. Thank you all.
Thank you very much, our chairman, for the welcome. And indeed, you have actually hit the nail, and that is essentially what we task our keynote speakers and the speaker to focus on. So it's going to be an interesting engagement. I will implore participants to use their pen and jot down what our reputable speakers will deliver to us. And let's use the chat box. Where you have question, please feel free to write it so that we can refer to it at the due time. We will go straight into the third item on the agenda, which is reading the citation of the keynote speaker, Dr. Hannatu Ayuba Usman. Dr. Ayuba Hannatu Usman is an MBBS graduate of the famous Ahmadu Bello University, Zaria. She has additional postgraduate qualifications from Ahmadu Bello University, Zaria, with Masters in Public Health, MPH, and Masters in Disease Risk Management and Development Studies. It is worthy of note that Dr. Hannatu also acquired several other professional certifications from reputable institutions across the globe, which include Northern Illinois University, School of Global Health, University of Copenhagen, School of Health and Related Research, University of Sheffield, United Kingdom, and the Royal Tropical Institute at the Netherlands, amongst many others. Dr. Hannatu is a consultant radiation and clinical oncologist at the National Hospital Abuja. She is the Chief Executive Officer, Cancer Consciousness Initiative, CCI. Our keynote speaker is the program lead, Tele-Oncology Hub, cancer advocate and researcher. She is a co-chair, Nigeria Cancer Society Screening and Outreach Committee. She doubles as member governing council of the National Cancer Intervention Fund, NCIF. She is ASCO CT Cancer Challenge LPWO Cohort 2 lead and convener, Global Health Connector Nigeria Ecosystem. Distinguished participants, it's my pleasure to present to you Dr. Hannatu Ayuba Usman to deliver her keynote address. Dr. Hannatu, you have the floor. Over to you.
Hello, we stand on all these protocols. Can you hear me?
Yes, we can hear you loud and clear. Please go ahead.
Afternoon and happy World Cancer Day to you all. So it's my pleasure being in your midst today, discussing this very important discourse today about patient-centered cancer care. Hello, can you hear me? It's cracking from here.
Yes, we can hear you loud and clear.
We can hear you.
Okay, so please can you just put on your, just share your screen from your end, sir. Hello, Mrs. Naraka, just share your screen from your end. Can you do that?
Okay, let me do that. Here. Let me do it.
All right, thank you, sir. So it's my pleasure today joining you all to commemorate the World Cancer Day to discuss a topic that is very close to our hearts as we walk the journey of caring for cancer patients together. The oncology pharmacists and the pharmacists are unsung heroes of cancer care. Their voices are golden in the multidisciplinary team management for cancer patients. And that is why I feel honored to present patient-centered care from the onco-pharmacist or pharmacist perspective. Sorry, I have to switch off my video because it's dark here. It seems dark, and also it's disturbing my bandwidth. So patient-centered care is holistic, individualized approach that treats the whole person, not just the disease, by aligning treatment with the patient's unique values, preferences, and needs. It emphasizes shared decision making, emotional support, that holistic care we always talk about. Patient-centered care considers the bio, that is the type of cancer we are managing, the physical symptoms, that's the physical domain, the vomiting, diarrhea, bleeding, all those that we manage, the emotional support, which we, as members of the MDT, which comprises of the different doctors, the pharmacists, the onco-pharmacist, I love this word, even though in the dictionary we're trying to enable the onco-pharmacist. So, sorry, please, just go back to the other slide. I have not finished discussing. Looking at the MDT specialist team, we have different healthcare workers all involved in that holistic care for the patient. Looking at the psychological domain, which is the emotional support and the psychological support that the family members give in year one. So at different domains that the MD pharmacists are all involved in giving their best, fostering a supportive environment that enhances patient engagement and satisfaction. We in the MDT team also encourage shared decision making because it involves the patients in the decision-making process regarding their treatment option, leading to choices that align with their values, resulting in better adherence and outcomes. Also, patient-centered care also encourages improved communication. That communication is very important. We have to enable effective communication between healthcare providers and patients, and this helps in addressing fears, preferences, and expectations, thus improving the overall experience and satisfaction with care. Next slide, please. The oncology pharmacists or pharmacists have big roles in cancer care. During the MDT meetings, the pharmacists give us an insight into so many issues that may be swept under the carpet. They raise the context that they have an idea of the patient. They have an idea of this patient's values, because these patients also reach out to the pharmacist and they involve them in so many decisions. So they get to hear about this patient, they contribute to the prescription stage, they enable access with patient assistance programs, and they are also involved in the chemotherapy reconstitution, monitoring and managing of cancer therapies, ensuring patients are on the most effective and safest medications while minimizing potential side effects. The pharmacists also have a big role in patient education and policy making, because they provide vital information about medications, potential side effects, and proper usage of medications, empowering patients to manage their treatment effectively. Also, they are involved in interaction checks, innovative research studies, health system needs assessment, strengthening activities are carried out by pharmacists in cancer care. Adverse reaction monitoring is also one important area in which pharmacists are key in identifying, reporting, and managing adverse drug reactions, contributing to overall patient safety and compliance. It's important that it matters. It enables improved outcomes. Next slide, please. It enables improved outcomes, reduces the burden these our patients face, and also its personalized treatment. The oncology pharmacist is involved in expert consultation. They specialize in oncology pharmacy, providing expert advice on complex cancer regimens tailored to individual patient needs and health conditions. Other pharmacists too are also equally important, because our patients could also have other illnesses, and these pharmacists are key to guiding them in taking their medications or any adverse side effects. They get to report them even from the community level. The pharmacists are also involved in innovative research and clinical trials support. They assist patients into potential benefits and risk of experimental therapies. The pharmacists also collaborate with healthcare teams. In our teams, we have nurses, psychologists, clinical psychologists, the psychiatrists, the radiologists, different doctors, the counselors, all involved in bringing their inputs to the holistic care for this patient. Even the clergymen are all components of the specialist team, the MDT team managing the patient. And because they work closely with oncologists, nurses, and other healthcare professionals, they are also involved in developing comprehensive treatment plans, fostering integrated cancer care. Next slide, please. Patient-centered care also has certain challenges. In our low-middle-income countries context, we understand how our health systems are a little bit fragile, even though we have the healthcare specialists, we have the healthcare workers, we have the service delivery aspect, we have the governance, but our healthcare systems still need to be strengthened in different ways, and that is why we all need your hands all to be involved in health system strengthening activities. Challenges in cancer care, patient-centered cancer care, are a myriad. However, there's the problem with access to medication. Patients often face barriers in accessing necessary medications due to cost or availability. And the pharmacist or the oncology pharmacist has a role to play in supporting the patient to be able to access certain patient assistance programs that we have. Also, managing multiple medications. Our patients may not be open to tell the doctors the kind of alternative medicines they take, but they open up to some other specialists, which also include the pharmacists and the nurses, the patient navigators. They will be able to notify that I'm also taking also this other spice, this other medication, and if there are any issues, these individuals are involved in talking to the MDT and managing whatever situation the patient has. Also, that psychosocial support, it's not only by the patient navigator or by the MDT team are all involved in addressing the emotional impact of cancer, because it's quite crucial. United by unique is a very powerful word. When you meet a cancer patient, you are meeting in different phases. There's diagnosis. Cancer, it's not easy for it to go down. And at that point, you're meeting your patient in different phases. You may be meeting this woman who has just received diagnosis. She's in denial. The other person is angry. The other person is feeling guilty. The other person is feeling anxious. The other person is feeling miserable. The other person is resilient. So at this point, they are navigating that phase of acceptance, that psychosocial support, that compassion in all that we do, and empathy that we show to our patient is very important. It enables their care. It enables them to come back, because they are facing a lot of cancer care barriers, cancer disparities in our context. So we have to make the difference. And the doctors, the nurses, and even other cancer survivors who carry out patient navigators, the peer navigators, the oncopharmacists, the psychologists, the counselors, you are all important in this work, in ensuring that our patients receive the patient-centered care that they deserve. Next slide, please. Future directions in cancer care, the use of telehealth. The use of telehealth and mobile health applications can enhance patient-provider communication, improving adherence and monitoring of treatment, and the pharmacists are key in this process. We have the Tele-Oncology Hub program, which we carry out in the northeast of Nigeria, involving telemedicine consultations, patient navigation, and I'm proud to tell you that we have oncology pharmacists and pharmacists that collaborate with us in the different centers, really helping with such processes to go on. And this is not new. There are many other areas that are involved in innovation, in collaboration, and we are happy to have our oncology pharmacists supporting us in different areas in the continuum of our patients' care. For personalized medicine, the pharmacists are very key. Advances in genomics and biotechnology paves the way for more personalized treatment plans. And this requires pharmacists to stay updated on emerging therapies and their implications. Also, interdisciplinary training, emphasizing the importance of interdisciplinary training for all healthcare providers can further improve the quality of care that we give our cancer patients, encouraging a collaborative management approach, enabling patient-centered care. Next slide, please. So as we enhance patient-centered care in oncology, in summary, is bolstered by the expertise of pharmacists and oncopharmacists and other valued members of the MDT. And this enhances the treatment experience for cancer patients. So by prioritizing patient engagement, education, and personalized care, we can significantly improve treatment outcomes and quality of life for individuals facing cancer care. So we call on all our specialty dear oncology pharmacists and pharmacists that now at the Global Health Connector Nigerian ecosystem, we are looking at collabo action. So it's not just collaboration, we are looking at carrying out collaboration and also walking the talk. Patient engagement, education and support, personalized care, respect for values and preferences of the patient, shared decision making, encourage all of this. Encourage holistic approach in your centers, encourage information and education. You can do this by different patient navigation programs, and you can also have spend with yourselves too. Also, you're managing the patient, you're managing that individual, you're managing at home. They are all equally important, and as much as possible, we want them to all be on the same page with us. So thank you very much for this wonderful opportunity to speak with our unsung heroes of the MDT, the pharmacists and oncology pharmacists of Nigeria. Thank you very much. Over.
Impressive. Thank you very much. Please, let's give the virtual applause for our keynote speaker. Very concise and precise, on point. She has successfully delivered the keynote and donated about 10 minutes to the program. Thank you very much, Ma. We truly appreciate the industry and the focus you have given specific areas of action, highlighting the challenges and so on. So as we stated during the program ground rule, please, you can put in your questions at the chat box. Then when it's time, definitely we'll refer to it. I want to seize this opportunity to particularly welcome onco pharmacists and onco nurses all the way from Federal Medical Center Jalingo in Taraba State. I'm aware other health professionals from Ahmadu Bello University Teaching Hospital are also here with us. Colleagues all across the country and in Abuja are all on the platform. Thank you, and thank you for coming on board. I will go straight into the next item, which is the reading of the citation of the second speaker, Pharmacist Nkoyo Bozega. Pharmacist Nkoyo Bozega is a Bachelor of Pharmacy graduate of the renowned Igbenedion University, Okada, with several professional capacity building certifications from the National Institute for Cancer Research and Treatment, the West African Postgraduate College of Pharmacists, University Learning Systems, as well as the ISPO, which is the Health Professional Society for Health Economics and Outcomes Research. Pharmacist Bozega is a passionate oncology pharmacist at the Federal Medical Center, GHC Abuja, committed to delivering patient-centered cancer care through safe, effective, and personalized medication optimization. She is a member of the Pharmaceutical Society of Nigeria, currently training with the West African Postgraduate College of Pharmacists and pursuing a Masters of Public Health program at the Ahmadu Bello University, Zaria. It's my singular honor and pleasure to present to you Pharmacist Nkoyo Bozega to deliver her presentation. Pharmacist, you have the floor.
Good afternoon, everyone. Thank you very much, Dr. Danraka, and happy World Cancer Day to everyone. At some point, I may have to go off the video because it's also affecting my bandwidth. And Dr. Danraka, please, can you help share my slides as well, if you don't mind? Thank you, Dr. Hanatu, for a wonderful presentation, and thank you for the time, the extra time you've given to me. Just kidding. I'll try to be as brief and straight to the point as possible. So, my name is Bozega Nkoyo. I'm an oncology pharmacist from Federal Medical Center, Jabi. And today we are marking World Cancer Day with a simple message, united by unique. And what that means in plain English is this: every cancer patient is not the same. Even if the diagnosis is the same, they still differ. Two women may have breast cancer, but one is a nursing mother and another is a civil servant with hypertension. So the plan cannot be one size fits all. And that's where pharmacy fits in strongly, because medicines can either support the patient through treatment or become the reason that the treatment fails. So in the next 20 minutes, I'll share practical pharmacist-led steps that can help improve safety, adherence, and access. Things that we can start doing immediately in our practice, in our daily practice. So for my objectives, at the end of this session, we should be able to do 5 things. First of all, we should be able to define people-centered pharmaceutical care. We should be able to spot high-risk adverse drug reactions early and know how to report them effectively. We should be able to prevent drug-drug interaction, also optimize medicines across the cancer journey, including oral anti-cancer therapy. Next slide, please. I want to be as fast as possible. So when we say people-centered cancer care, we are saying treat the human being, not just the tumor. And how do we want to achieve that? First of all, we want to co-design care with these patients. In Nigeria, it is very crucial because patients, they have there are factors in faith, family influence, financial capacity, and even the fear of stigma can affect their care. So if we ignore this, adherence suffers. Secondly is continuity across settings. And this goes from the hospital to the community to the homes. Many of our patients leave the hospital, and when they leave the hospital, that is when the real struggle starts. You talk about distance, you talk about cost, side effects at night, and no quick access to advice. And then the third is respecting the whole regimen. We need to understand that chemo is not the only medicine. There is supportive care, there is comorbidity drugs, and then sometimes herbals and supplements. And finally, we're looking at equity and access. Equity and access, they are clinical issues. If a medicine is out of stock or unaffordable, the outcome changes, as we all know. So United by Unique is not just a slogan, it is a daily clinical approach. Next slide, please. So now, why medicines make or break cancer care? Based on these Global statistics, we can see that, as we all know, the top cancers are breast, prostate, and cervical. And the reasons why medicines make or break care here is because oncology is complex. These are patients may be on chemo, at the same time they are on antiemetics, they are on antibiotics, they are on pain medications, plus drugs for hypertension and diabetes. So polypharmacy is normal when it comes to dealing with cancer patients. And when polypharmacy is involved, preventable harm becomes common. Also, another reason is oral anti-cancer therapy is increasing. And this simply means that monitoring now shifts from the hospital to the home. And if we do not create follow-up systems, non-adherence and toxicity will quietly rise. Supportive care is another make or break factor. If nausea, pain, mucositis, infection is uncontrolled, patients will miss their cycle or abandon treatments. And finally, access gaps, stockouts, affordability, substandard products, all of these directly affect survival and quality of life. So we can see that pharmacists are not optional here, we are central. Next slide, please. Pharmaceutical care in oncology. Next slide. I'm here. Pharmaceutical care in oncology is not just about dispensing. It is actually a structured set of deliverables from the first visit to survivorship. Now, what does it entail? The first step is the medication reconciliation. When I mean this, I mean all medicines. You want to look at the prescription medicines, you want to look at over-the-counter medicines, the supplements, pregnancy status where relevant. In our practice in Nigeria, if you don't ask questions, the patient may not tell you. So you want to know all the medicines that the patient is using. Second is therapy review and individualization. You want to look at the dose, the routes, and then the renal and hepatic adjustments. Third is patient education and shared decision. You need to explain what to expect, the red flags. we need to create a plan that fits their real life schedule, their finances, their work schedule. And fourth is monitoring and follow-up. We need to follow up on labs, toxicity tracking, and also proactive calls, especially for patients that are on oral medications. And finally, we're looking at documentation. We need to learn to record interventions, prevent harm, and also improve adherence. This is what builds oncology pharmacy value. Next slide. So we're looking at medicines optimization across the cancer journey. Medicines optimization simply means that we maximize benefits, we minimize harm, and then we make the therapy fit for the patient's life. And this starts from the first stage. So at diagnosing and staging, we want to check all the baseline medications, the comorbidities, the organ function, and fertility considerations where appropriate. At treatment, we want to ensure correct treatment protocol. During treatment, we want to monitor, focus on toxicity patterns, and also provide supportive care, because during the treatment monitoring, this is where we can prevent those delays. Also, during admissions and complications, we want to manage issues that come up like neutropenia, infections, and also do what we call smart deprescribing. So when we do that, we stop what is harmful and give what is necessary. And finally, transition and survivorship, which has to do with the long-term adverse effects, comorbidity management. So the pharmacist's role is actually continuous. It is not a one-time dispensing process. Next slide. So now I want to talk about adverse drug reactions. Adverse drug reactions, as we all know, it's one of the biggest reasons that patients stop treatment or doctors reduce the dose. The high impact adverse drug reactions we can reduce include myelosuppression, chemotherapy-induced nausea and vomiting, mucositis, diarrhea, hand-foot syndrome, and immune-related adverse events with checkpoint inhibitors. So now, what's the practical workflow when it comes to adverse drug reaction? The first thing we want to do is we want to start with the baselines. We want to check that the labs, the risk factors, the comorbidities, toxicities are in check. And then prophylaxis. You want to administer prophylaxis, antiemetics, growth factors when indicated. And the next is the cycle-by-cycle monitoring. As health professionals, as pharmacists, as people in the oncology space, you don't just rely on how are you alone. We need to learn to ask these patients targeted questions. Do you have a fever? Do you have mouth stores? How are you stooling frequently? Do you have palpitations? And then also there's the early intervention. We need to know when to hold the dose when needed, give supportive medications and also refer. Finally, we need to learn to document and report through pharmacovigilance. As health workers and pharmacists, we need to know that reporting is not punishment. Reporting is actually how the system improves. And consistent reporting strengthens our NAFDAC data and also institutional learning. Next slide, please. So now, drug-drug interaction. Drug-drug interactions are silent because the patient don't feel them immediately until the toxicity hits or the treatment fails. And then in oncology, the common traps that happens in drug-drug interaction happens with the CYP, that's the cytochrome P450 liver enzymes and transporter interactions. This is mainly common with some antifungals, macrolides, anticonvulsants. And also in our settings, we know that our patients, they like to take a lot of herbal and immune boosters, so alongside chemo. So this also causes a lot of drug-drug interaction. And also antiemetics like the ondansetron, fluoroquinolones, they can also increase arrhythmia risk and high risk of palpitations when they interact. So the practical point here when it comes to drug-drug interaction is that as pharmacists and health workers, let us not guess. Build a routine drug-drug interaction check step. What do you want to do? Before every cycle, you ask questions. Whenever a new medicine is added, you also ask the patients. A 2-minute check can actually prevent complications in the future. Next slide. So for oral, next slide, slide 9. Oral anti-cancer therapy treatment. Oral anti-cancer therapy looks easy because it's a tablet. But the truth is it's actually high risk because the patient manages it at home. So now, why does adherence sleep? Adherence sleeps because side effects can occur in these patients and they don't have rapid access to advice. There may be some restrictions, food restrictions that come with taking the medications. When these patients miss their doses, they are confused. They don't know what to do. And also, there's the travel burden, transportation, and there's the low health literacy. Secondly, so now what works in practice for us to know how to avoid, these drug-drug interactions, and also how to counsel our patients on proper oral anti-cancer therapy. First of all, you want to do teach-back counseling. Teach-back counseling simply means that you ask your patients to explain it back in their own words. When you counsel them, let them tell you what they understand. And this confirms that they understand what you've said. Second is a written plan. What to take, when to take it, are you taking the medication with food, and what to do if they miss a dose. Thirdly is early follow-up. A call or message within 48 hours after starting is appropriate because this is when this side effect starts. And also discouragement is high at that point because once these patients experience side effects, they don't want to take the medications again. And also we have to follow up with these patients, calls, SMS reminders, family involvement when appropriate. And if toxicity happens at the end of the day, we have to find a way to reduce panics and prevent dangerous delays. Next slide. So now let's look at medication safety. Medication safety in oncology is a chain. And if one link of that chain breaks, unfortunately, the patient pays. So it's our duty to ensure that this chain or the link is not broken. So first of all, we have to ensure standardized protocol when we're ordering. So the first is the order standardized protocol. You make sure our chemo orders are complete. You verify the weight, the PSA, the diagnosis, because incomplete orders can be a major source of error. Second, you want to verify, you do a double check, independent double check, check that is the right drug, the dose, the right route, timing, and pre-meds. And then the third is the preparation. During the preparation, you want to ensure aseptic techniques, correct diluents, and make sure that these medications are labeled properly. And when administering, you want to administer to the right patient at the correct infusion rate. Let's always be ready for extravasation and monitor accordingly. And finally, the last one is the learn. We need to learn to document near misses. Let's learn to document errors and adverse drug reactions and use them to improve on quality. The goal in documentation is not blame, but the goal is for us to be better than how we were last week. Slide 11, please. We want to talk about access. In Nigeria, access is actually not a background issue. It is a clinical outcome. Why? Because if the drug is not available, affordable, is of poor quality or wrongly used, the patient's outcome changes. And what limits access in LMICs, that's low middle income countries like Nigeria, what limits access here? We talk about stockouts, we have fragile supply chain. The major factor that limits access, out-of-pocket payments, which eventually delays treatment, and then limited diagnostics for biomarker-guided therapy. So as pharmacists, what can we do practically to help with access? We can align procurement and use essential medicines lists like the WHO and the national list. We can use therapeutic interchange and biosimilars appropriately where evidence supports it. We can help patients, especially the indigent patients, to navigate assistance programs and also help them advocate cost-conscious regimens. And also we can practice stewardship. We do this by safe vial sharing and also preventing wastage during dosing rounds. So let's go to the next slide, slide 12. This slide is a simple and implementable take-home model. I call it the 5S model. And as we can see, there's the screen, support, safeguard, secure, and share. So the first thing you want to do is you want to screen the medication, check for drug-drug interaction, check for organ function dosing. This is your first safety gate. And after that, you want to support. Support involves teach-back counseling, adherence plan. Let's not just educate, let us equip the patient so that they know what to do even when we're not there. You want to safeguard. This has to do with adverse drug reaction prevention, monitoring, pharmacovigilance reporting. And then we secure. Secure has to do with access, stocking of the medication, ensuring that they are affordable. And then share. Sharing has to do with documenting interventions and outcomes. This is how we prove our value, when we share and we document interventions. If a pharmacy team or a health team can actually adopt this 5S approach model consistently, we will see that there are fewer interruptions, fewer preventable adverse drug reactions, and even better MDT collaborations. This model is actually simple enough for us to start tomorrow. Next slide. So now let's look at the practical aspect. We want to look at a case study. Let's not just talk. Let's look at a case study. A patient, a 45-year-old woman with ER-positive breast cancer, is starting tamoxifen, but she's also on fluoxetine for depression, which is as a result of her diagnosis. And she also uses a herbal, in quote, immune booster. Now, if we treat only the tumor, we're just going to dispense the tamoxifen. That's what we're seeing. But if we treat the person, that is where United by Unique comes in, because we're not treating only the tumor, we are treating the person. It becomes a pharmacy intervention opportunity. If we recall our 5S, what do we want to do here? We want to screen, identify the key issues. First of all, fluoxetine can actually reduce tamoxifen activation through the liver enzyme inhibition. So that can, on its own, reduce effectiveness. We also want to support this patient, counsel on what to expect, side effects, and give the patient a written plan. Safeguarding, how do we safeguard? We advise the patient to stop the unknown herbals due to the interaction risk, and then we monitor. Then we secure. We secure by discussing the cost and ensuring reliability. We ensure that this patient is able to keep up with their medication.
Hello, pharmacist Koyo, are you with us? Can we hear her? Hello, can we hear her, please?
Now, I think she's network issues or something like that.
Okay, I think the network is not stable from her side, but she has about how many slides to go? Let's just give her a moment. I think she's almost rounding up. She's on her penultimate slide. And you know how technology is. We'll just bear with it. She's actually at the crux of the matter. This case study demonstrates how the Unique by United can be exemplified in the care for a cancer patient. This is what the oncology pharmacists, together with the team and the nurses and the physicians, do in a collaborative manner to ensure that there is pharmacotherapy optimization. Pharmacist Luca Nalle, can you hear us?
Yes, I can hear you. I think she's back on the platform.
Okay, is she
The
back?
network threw me off. I'm sorry.
That's fine.
Yes,
Because
I'm back. The network actually threw me off.
Go ahead, please go ahead.
So I was just about to conclude. I'm sorry, everyone. It
No
was
problem.
the network.
It's technology.
Yes. So let's go to slide 14 and conclude. Okay, so Today, I just want us to leave here with 3 simple things that we can start doing immediately as pharmacists and health workers in our cancer care journey. Number 1, I want us to make pharmacy part of every new cancer treatment plan. It's very easy. Before a patient starts chemo or any oral anti-medications, let the pharmacy do a quick check. What medicines are the patients already taking? Are there any herbs, any TB drugs, any blood pressure drugs? And then we counsel them clearly what to expect, how to take it, and what danger signs to watch out for. This one step can actually help prevent plenty of problems. Secondly, let us learn to take side effects seriously and report them. Many patients actually stop treatment because of side effects. Sometimes they don't even tell us early. So we should routinely ask the patient, any fever, any vomiting, let us ask questions. And once we notice an adverse drug reaction, we document and report it appropriately. And thirdly, let us treat access like a medical issue, not just a pharmacy issue. It's not a pharmacy store issue. It's actually a medical issue. If these drugs are out of stock, if they are expensive or fake, treatment fails. So it's an all-rounder. So we should plan to stock better, guide these patients to reliable sources, and also push for affordable options. Thankfully, we have the NHI now, so patients are able to access most of their medications at a very reduced cost. So when we do this, that's how we make United by Unique real and not just a slogan. So as we close, as I end this presentation, I just want to say that World Cancer Day reminds us that we are united by a common goal, but every patient is unique. As pharmacists, our daily work can be the difference between successful treatment and preventable failure. Thank you for listening.
Impressive. Indeed, I was able to present within her allotted 20 minutes, and despite the technological intervention, disruption, she was still back as God will have it, and she delivered. Thank you very much, Pharmacist Nkoyo, for that very broad and comprehensive cancer care, the pharmacist perspective. Before we go into goodwill messages, I want to use this opportunity to also welcome specifically and recognize some other dignitaries that joined us. Pharmacist Jelili Kelani, the National Treasurer for the Pharmaceutical Society of Nigeria, a fellow of the Pharmaceutical Society of Nigeria, joined us onto the platform. Sir, you are welcome. Also, Pharmacist Hawa Idris, the Director of Pharmaceutical Services at the National Assembly Clinic, also joined. In the same light, a director here at the National Hospital, Pharmacy Department, Head of Department, Pharmacist Clara Adeshola, you are welcome into the call, ma. A pharmacist from Margaret Lawrence University Teaching Hospital, Abuja, Pharmacist Nembang Gondi, you are welcome onto the call. We have dental therapists and other pharmacists from University of Abuja Teaching Hospital, Gagolada. You are all welcome. All colleagues, physicians, pharmacists, nurses, and other healthcare professionals that have joined us from Federal Medical Center, Jabi, National Hospital, Abuja, you are all welcome onto the call. You will agree with me, this webinar is very business-like. As much as possible, we want to save time to call on our distinguished persons to give us 1 or 2 goodwill before we enter into the question and answer session. So the keynote speaker and the speaker should please be attentive so that when the questions are asked, we'll give room to all that have questions exhaustively so that you put the questions together and you respond collectively. I will start by calling Pharmacist Clara Adeshola to please deliver a goodwill to this webinar. Ma, you have the floor.
Good afternoon, everyone. It's a pleasure being in your midst this afternoon. And we are glad that our health sector is beginning to appreciate that virtually all forms of ailment require multidisciplinary in the management. One and the foremost is in the space of cancer. I'm also glad to let you know that one of the centers, as I've been introduced, I'm from National Hospital. Our center is one that appreciates the role of pharmacists in the multidisciplinary approach of the management of cancer. And on behalf of the hospital, the CMD, Professor Raji Mahmood, I want to say welcome to everybody, and it's been a nice time together. Thank you for appreciating pharmacists in the space of cancer, and thank you for appreciating the role we play in the management of cancer, not only in Nigeria, but worldwide. We are actually united, but unique. So we are joining voices in celebrating or commemorating this year's World Cancer Day. Thank you very much. Have a good deliberation.
Thank you very much, Ma, and we are glad to hear your contribution and the sterling delivery of care we are getting from National Hospital Cancer Center. I want to call on Pharmacist Karim Sabum, a fellow of the Postgraduate College of Pharmacists, to deliver goodwill on behalf of the Federal Medical Center, Jalingo, Taraba State. Please, you have the floor, Ma.
Good afternoon, everyone.
Good afternoon.
Can you hear me?
Yes, we can hear you loud and clear.
Yeah, my name is Pharmacist Sabum. Yeah, my name is Pharmacist Karim Sabum, a fellow of the West African Postgraduate College, and I'm the oncopharmacist, Federal Teleoncology Hub in the Federal Medical Center, Jalingo. It's been wonderful. And we say the role of the pharmacist is limited. We are just everyone doing everything. And I want to thank our mentor, Dr. Hannatu Ayuba, for initiating this process, bringing access to the less privileged right up in Jalingo. I appreciate you much. And I bring team, but we are trying to do a very good job. We are bridging up between the less privileged and people. So, on behalf of everybody here in Bingo, I want to thank you for making us a part of this celebration. And we look forward to better celebrations in the future. Thank you, and I wish you all very good celebrations. Thank you.
Thank you very much for all the way from Jalingo, Taraba State. Please take advantage of the chat box to drop your questions and concerns so that we'll read it at the time for the Q&A, and I will allow our keynote and speakers to respond. I will call on Nurse Hawa Mustafa Daraka from Ahmadu Bello University Teaching Hospital, as well as board member of the Hajiya Saadiya Cancer Care Foundation, to deliver a goodwill. Please, you have the floor, Nurse Hawa.
Assalamu alaikum and good afternoon all.
Good afternoon.
Good afternoon.
It's a pleasure for me to be among this organization. I'm very delightful for the Association of the Pharmaceutical Association for organizing this webinar. And I will be very grateful if we are going to continue in this manner. Thank you very much. My sincere appreciation to the chairperson, that's Pharmacist Salamatu, and other organizers committee. It's indeed a great webinar, as today marked the World Cancer Day. And I pray so this is going to be more impactful so as to continue enlightening the minds and strengthening the hearts of people closer. And we are praying so in future that Nigeria is going to be a free future of free from all these cancer problems. Thank you very much all, and have a success day ahead.
Thank you very much. Thank you.
Thank you for joining us and making us proud. Thank you.
Thank you. Before we go to the Q&A, I will call on Pharmacist Luca Nanle from Federal Medical Center to deliver a goodwill on behalf of Federal Medical Center, GHC Abuja. Pharmacist Luca, you have the floor. Pharmacist Luca, are you still with us? If Pharmacist Luca is not here, I can see Pharmacist Onose Andrew from FM Iyogun from Federal Medical Center, GHC Abuja. Please give us a goodwill on this platform. Pharmacist Andrew Onose. Pharmacist Andrew Oyogun. If none of them is around, I will call on Pharmacist Sarah Okemenem to deliver a goodwill on behalf of Federal Capital Territory pharmacists. Please give us a goodwill, ma. Pharmacist Sarah Okemenem. If they are not ready, I think it is good to go on to the Q&A. I will start with a drop by Mr. Buba Abdullahi. He says, my name is Abdullahi Buba. Under the challenges, patients who do not have access or are not financially okay to take care of their cancer issue, is there any room for assistance? So, keynote speaker, please take note. Is there any room for assistance for our patients that do not have access to all the laudable interventions that we can offer? Then there is also a drop message here that, okay, all the others are commendations, a very wonderful presentation and a good presentation. This one is from Naomi Mbaga. Waiting to hear the call on survivors for the needed support to buy drugs for treatment and sustainable health. There is a survival support group in Jos. Thank you. Thank you very much. That's an information that we need our survivors to link up to survival groups for other palliative support. So if there is anybody that has a particular concern or question to raise for our keynote speaker and the speaker, please indicate by raising your hand so that we can give you the floor to speak. Because after this, we'll have to ask them to wrap up based on the comments and the general feelers. Anybody, you can indicate and we'll give you the floor, please. Pharmacist Hassana Amadou, can you please unmute and give a goodwill on behalf of FCT pharmacists, oncology pharmacists? Pharmacist Hassana Amadou. Pharmacist Nembang Gondi, can you give a goodwill on behalf of Margaret Lawrence University Teaching Hospital? Okay, Buba, I will come to you, just hold on. Pharmacist Nembang, can you hear me? Okay. Mr. Buba Abdullah, please unmute and say something if you have something to add.
Yes, I think this is a very wonderful presentation. I want to appreciate the whole presenters, and after that, I want to ask one question again, sir, if I'm permitted.
Please go ahead.
Sir, you know, I am in one community, which I know we have a lot of people who does not even believe that there is need for the patient with cancer to come to hospital. So I want to ask, you know, how can we do for those people, like for us that we are, you know, enrolled into that community patient navigator? What can we do? What role can we play in trying to make them believe to come to the hospital to access this wonderful opportunity. Thank you.
Thank you very much. I'm sure the keynote speaker has heard you clearly. The role of community persons to remove the myth and also advocate, or rather educate persons to access care in the hospitals. We will come to you, Dr. Hannatu. Let's hear from Pharmacist Aboliat from Federal Ministry of Health. Please, Pharmacist Aboliat or Aboliat from Federal Medical Center, can you say a goodwill on behalf of pharmacists from your facility? Unmute and speak to us, please.
Okay. Hello, good afternoon, everyone.
Good afternoon.
Good afternoon, distinguished senior colleagues and colleagues, to the beautiful presenters. I am Pharmacist Aboliat from Federal Medical Center, GHC Abuja. I would want to say a happy World Cancer Day to us all. And very beautiful team. I hope that by all our contributions, we'll all contribute to ensure that cancer is a thing of the past in our nation, Nigeria. A warm greeting to everyone on this platform on behalf of all the pharmacists at Federal Medical Center, GHC Abuja. And I hope that through our practices, we will help to eliminate cancer. Thank you very much.
Thank you very much from FMC Abuja. There is a question here before I yield the floor to our keynote speaker. Pharmacist Abubakar Dauda is asking a question that what can we do as healthcare professionals? What intervention can we make as professionals to enlighten the society on cancer and the regarding effectiveness, alter active medicine, as well as some prefer alternative medicine? So I will yield the floor to Dr. Hannatu Ayuba to respond to some of the questions and wrap up. Then after you, we'll also call on Pharmacist Nkoyo to also respond to the issues raised. You have the floor, ma. Dr. Hannatu, you have the floor, ma.
Oh, thank you very much, sir. Thank you. Thank you, Mr. Buba Abdullahi. Mr. Buba Abdullahi is one of our passionate community patient navigators in the Gombe Tele-Oncology Hub Community Patient Navigation Program. So, Mr. Buba, thank you for that question that you asked. I know it's all out of the passion you have for the work that you do in the community at the grassroots, where the bottom billions reside. So as a community patient navigator, among the lectures I gave you, I'll just give you a small recap to remind you that for you to educate and encourage people to come to the hospital or the healthcare facility, first you have to build trust. And this has to be through community outreach and one-on-one interactions. You know the gatekeepers in the community, you know the clergymen in the community, you know the leaders and elders in the community. You will need to go into the community. That community entry is very important. It's such gatekeepers and notify them about what we are doing about this community patient navigation. Cancer is a disease that everybody is worried when they hear about grassroots. And it's like it's taboo. It's not even every patient navigator. You are the voices in the community. So you have to speak with the elders. That's those socio-cultural barriers that patients face from the community. This is the level at which you need to bring this socio-cultural one-on-one interaction about cancer. And just as your coordinator is going to World Cancer
Can we hear her? The network is fluctuating.
Line is fluctuating.
Yes, I think from her side, the network is not allowing us to hear her. Okay.
Talking, but I get the network, sir.
Thank you very much.
Really
So the speaker, can you also add voice to some of the issues raised and wrap up?
Okay.
Can you?
So, okay, she's back.
So addressing specific concerns, because when you listen to people in the community and you raise awareness about cancer, you describe how this disease occurs and how it's managed in the hospital. That's multidisciplinary team management, which involves even you, the community patient navigator, the different doctors in the hospitals, the pharmacists, the nurses, the community health extension workers, the environmental health people. All these are involved in the management of this patient. And because we are talking about all the domains of care, that biological, the kind of disease, the treatment for it, the drugs we give, the physical symptoms which are managed, vomiting, diarrhea, bleeding, pain, the psychological, which you also are part of it, the family is also part of it, giving emotional support to the patient and enabling this patient to be able to withstand the challenges of treatment, the emotional turmoil they go through. Some families also add to these problems for patients, and that is why that awareness that you do in the community is powerful, because you're encouraging community engagement for the patient. Cancer ways in which the patient needs the help. Then the spiritual domain. In the spiritual domain, we are not men of God. We are healthcare workers. We may be able to counsel here and there, but then we ask the clergymen, imams, pastors to pray for them, and this is the holistic patient-centered care we've been talking about. So you are powerful in this area. You are the people in the communities. You are our ambassadors. You are the voice of us, and you are the voice of that cancer patient who is screaming and is in dilemma. So that is how powerful your work is. So we're going to have more and more communication in our different WhatsApp groups with your coordinators, and we are going to put you through all that. So happy World Cancer Day, and I'm looking forward to receiving your videos and your pictures from the World Cancer Day celebration. Thank you, sir.
Thank you very much. The second speaker, before you respond, there is a long epistle here. Let me just read it from Astagbadu. In our societies, herbal medications play a huge role in our illness management. People, especially those in rural areas, prefer herbal medications to modern drugs. Studies in pharmacognosy have proven that some of these herbal medications do show effectiveness. Is there any standardization in place for the alternative herbal medications for cancer in our country, fully considering the patient's financial status and also more willingness and more trust to take those herbal medications as opposed to the current modern oncology treatment options? Thank you. I think I'm in a right position to respond to this concern. Indeed, the pharmacists in academia, pharmacists in the natural medicine space, especially our own pharmacist, Zainab Sharif, who is an icon of traditional medicine and herbal medicine practice. Indeed, she's a practitioner with a herbal pharmacy here in Abuja. We are actually working together with various research labs and research institutes to standardize dosing of herbal preparations, especially from those that are genuine. The problem with alternative care and herbal medications is that there are, just like in orthodox medicine where you have quackery, the same way in the alternative traditional medicine, you have a lot of quacks. So, but with the genuine herbal practitioners, as I have mentioned, one of our own pharmacist, Zainab Sharif, who is a herbal expert, a traditional medicine expert, we are actually standardizing medications, and indeed some that have proven effect are being used as complementary to traditional medicine. Our advocacy had always been to say when you want to commence alternative treatment with genuine practitioners, they will always say, don't take orthodox. So we always discourage that. We believe you can actually do complementary care if you meet the genuine experts and they will know what is the component of the concussion, because another problem is a lot of the concussions, they don't know what it is. So what we do as experts, as pharmacists and medical practitioners, herbal practitioners, we standardize and disclose what medication is being used, because we know if pharmacist Zainab is giving you a herbal remedy, she will tell you what it is. It's not an unknown concussion. With that, I will call on the second speaker to add light on the matters raised before we conclude the session. Pharmacist Nkoyo, please, you have the floor. Okay. 2 to 3 minutes.
Okay, so, all right. There was a question that was asked if there's any room for assistance for, would I say, indigent patients?
Yes.
And I'm going to speak based on what happens in my facility, and I'm sure it's what cuts across all other facilities. So yes, there is actually room for assistance. When indigent patients come, what we do is that within the hospital, we try our best to assist them, depending on their financial status, like how bad it is. There are some patients that actually come in, the only thing they can do is just to afford the baseline tests. And after that, they don't even have money to start the chemo. So what we do in such cases that we can assist the patient most times with dose sharing. When some patients cannot finish their vial, we keep it for those indigent patients. And also within us, when organizations or communities, when they donate or support the hospital, we refer those patients and they can also benefit from the program. So yes, where there's a will, there's a way. We just encourage you, just come. When you come, we listen to you, we take your complaints. We would always find a way to help you when we know that you genuinely do not have and you are also interested in getting better. So yes, there's always help one way or the other. And then we all know that from time to time, NGOs, they come around, these foundations, they come around. So we have a register where we write, where we, keep the names of these patients. So sometimes we even contact them. Oh, there's this NGO that's come around. We think you will benefit from this program. And then some other organizations, they bring in medications. Like there's an organization that came in, supported with tamoxifen, supported with some oral anti-cancer therapy medications. And we contacted our patients that were on it and were able to give it to them. So there's always support one way or the other. We just want to let the patients know that they are not alone on this journey. We as pharmacists and healthcare workers, we always try and do our best to ensure that these patients get their care and they are able to sustain it.
Thank you very much. And it is also important to add that the National Cancer Fund has been very instrumental in supporting and augmenting the finances of cancer care. I think it's good to put on record, the National Cancer Fund has been doing wonderfully well in supporting a category of patients that have confirmed and diagnosed cases of cancer. They are enrolled into the program and they are usually reimbursed in their wallets to access care. Before we go to the concluding aspect of this webinar, I want to recognize the presence of our own zonal coordinator of the West African Postgraduate College of Pharmacists here in Abuja, FCT, in person of pharmacist Dr. Tijani Muftau. Sir, please unmute and give us a goodwill for both the WAPCP and the pharmacists in FCTA. Please give us a goodwill. Pharmacist Dr. Tijani Muftau Oyedele, please unmute and deliver. I can also see Pharmacist Amade. Is he our own Pharmacist Amade Enejo? You are welcome onto the platform. Our immediate past chairman of Association of Community Pharmacists of Nigeria here in the FCT. You are all welcome onto the call. Dr. Tijani, please, you have the floor.
Yeah, thank you very much, the coordinator. I want to sincerely appreciate the organizer of this program and our amiable presenters. On behalf of the West African Postgraduate College of Pharmacists, FCT Zone, we sincerely appreciate today's program. It's very apt. A lot has been learned, a lot has been delivered, and I want to give assurance that we are partners in progress, and the area of advocacy, the area of sensitization and support, we will always be there. Congratulations and happy Cancer Day. We will join hands to eradicate cancer in Nigeria and the world at large. And the same goes for FCTA pharmacists. We have a lot of oncology pharmacists appointed among us. We will be ready to partner at all time to support. Congratulations. We learned so much, and may God bless you all. Thank you.
Thank you very much, sir. Indeed, we have taken note of all you have said and the assurances for collaboration and support with the PSN Abuja branch. Pharmacist Amade Enejo, please, you have the floor to speak on behalf of community pharmacists on this World Cancer Day. A goodwill message from you, sir. Pharmacist Amade, please, you have the floor.
Good afternoon. You have not acknowledged me.
Okay.
Good afternoon.
Good afternoon. Go ahead.
Distinguished colleagues and my elders that are here, I'm seriously delighted to be on this call this afternoon, and I want to thank the organizers for this initiative. I've been looking forward to see that ACPN had a very good outing today, but when I saw this platform and such a thing is coming up, I was so excited, and I was telling my members that as much as possible, let many of them join. So I'm happy that this come to be this afternoon, and I want to thank all the speakers. You have done very well, and many of us have learned some new things here, and together with ACPN and all the FCTA hospitals and all other pharmacists in FCT will join hands to fight the war against cancer. Thank you very much for this initiative. I celebrate you all and will say the happy World Cancer Day. Thank you very much.
Thank you very much. Indeed, in the beginning, we duly recognize and put on record that every participant on the webinar is duly recognized. And indeed, we welcome all onto this and we appreciate your coming. As a way of wrapping up, my chairman, Ma, please, any comment before we conclude? Pharmacist Salamatu Orakwelu, please, any comments?
Well, I don't think I have any comments because you are actually coordinating very well. It's just to sincerely appreciate the presenters. You did justice to the topic. A lot was learned. You made it so simple that everybody will have something to take home today. And I think to add to issue of those that won't want to go to access care in the hospital. First, she talked about building trust, and also the way we approach them is also very important. Letting them know that the fact that they are diagnosed with cancer does not mean a death sentence, and at the same time, sharing their stories, letting people that are survivors to come to talk with them is also very important. It will also motivate them to go access care. Thank you very much.
Thank you very much, Ma. Hassan Istifanus Utan, do you have anything to say?
Yes, Pharmacist Danraka, he was saying
ahead.
he didn't acknowledge it as representative of Board of Fellows.
Okay, so sorry about that, please. Please say a goodwill to us.
It's a very good one. It's a very good one you people have put up. Very educative. I wanted to say the person who asked question about how to get, especially our people who don't believe that cancer is a treatable thing in the hospital. Well, as a pharmacist, you have to do a lot of referral when you come across. That's the only way
to make them appreciate what we are doing in the hospital.
Thank you very much, sir.
For bringing up this, and I think the rest of the chapters all around the state will try to at least imbibe what you have done at FCT. Thank you.
Thank you very much for having you, sir. We sincerely apologize for any oversight, and we welcome the comments you have said and also the assurance that FCT will remain a flagship for other chapters to follow. Thank you. As a way of closing, we sincerely appreciate and thank Almighty God for the opportunity and the gift of life to participate in this webinar, and also for allowing the technology for us to communicate, because if that had not happened, we would not have been able to communicate with ourselves. We, in no particular order, appreciate our chairman for giving the opportunity and the platform, and the ESCO for approving the webinar. The keynote speaker, who was approached within a short notice, I must say in less than a week, she was able to prepare and deliver this interesting and impactful lecture that is very insightful. Thank you very much, Ma, and may God continue to empower and enrich your cause to deliver more care and impact to Nigerians. To the speaker also, the second speaker, Pharmacist Nkoyo, you too, under short notice, you were able to deliver this very insightful and very comprehensive pharmacist perspective of cancer care. Thank you very much. To all our participants across the country, from Federal Medical Center, Jalingo, Taraba State, from Federal Medical Center, Abuja, from National Hospital, from Margaret Lawrence University Teaching Hospital, from Ahmadu Bello University Teaching Hospital, Zaria, from University of Abuja Teaching Hospital, from all facilities across Abuja and all centers. We appreciate your time. Thank you, and God bless. As a way of closing, it's good to remember that cancer remains one of the leading causes of morbidity and mortality worldwide. This is real. Cancer is affecting many families, affecting neighborhoods, friends, and colleagues. This is the reality in Nigeria, with the WHO, International Organization for Cancer Research Collaboration, stating that over 10 million lives are lost annually in sub-Saharan Africa, with disproportionate burden due to late diagnosis, limited access to screening, and inadequate treatment infrastructure. You will also agree with me that in Nigeria, cancer incidence and mortality remain high due to our own peculiarity, unfortunately, despite abundant resources endowed to the state. The infrastructural deficit in late diagnosis, limited access to treatment, gaps in public awareness, this webinar has addressed that it is not only symbolic, it is strategic for all caregivers to come together to foster dialogue, disseminate knowledge, and mobilize collective action to improve cancer outcomes nationwide. We cannot conclude without thanking everybody, the members of the press that have joined to cover this activity, this webinar, so that it can be disseminated to everybody across the country and the globe. It is a call to action. Indeed, by uniting health professionals, patients, caregivers, the media, and the public under the team United by Unique, Nigeria can strengthen its fight against cancer through awareness, compassion, and collaboration by all. Thank you, everyone. It is indeed a very insightful and very impactful webinar we have just had. Thank you, and God bless us all. Thank you. Thank you for participating. The keynote speaker, thank you. Our speaker, thank you for coming. Chairman, thank you for the opportunity. Pharmacist Zakaria Kefas, thank you for coming.
Thank you, sir.
Thank you very much. Thank you. We'll meet another time. Thank you, and God bless us all.
Thank you very much.
Thank you.
Thank you so much.
All that delivered today. God bless
you. Thank you, sir.
Mr. Zakaria, our colleagues all the way from Gombe. Those from Gombe.
That's fine. Thank you from Gombe.
Thank you.
Thank you.
Thank you, Pharmacist Karen. Thank you, ma'am.
Thank you. Thank you.
Thank you all. Thank you. That was great.
Thank you. Thank you. Thank you very much.
Mrs. Danraka, well done.
Thank you very much, sir. Thanks for participating, sir. Thank you.
Very wonderful.
Thank you. Thank you
My
very
doctor,
much.
thank you for good coordination. God bless you.
Thank you very much. We appreciate, sir. Thank you, sir. Thank you. Thank you. Thank you very
Chairman,
much.
thank you.
I remain loyal, ma. Thank you very much for the opportunity, ma.
My
Thank
chairman,
you.
thank
God
you.
bless you, ma. Thank you, ma.
Thank
Ngode,
you.
ma. Thank you.
Okay.
They share. Thank you.
Yes,
Thank you.
Thanks
so
for putting up this.
Thank you, sir.
Thank you so
sir.
much.
Wonderful
I
presentation.
greet
Thank
all
you.
my leaders here.
Thank
Well
you
done.
very much, sir. Thank you. God bless.
Thank
Khairan for this wonderful presentation.
Thank you
Thank
very
you so
much.
much.
God bless you too. Waiyakum. Thank you.
Thank you, sir. Jazakallah khairan
Thank you. God
for
bless you
this
too.
wonderful.
Thank you.
Wallahi, the present. Very wonderful. Thank you so much.
Thank
We
you,
really
Mr.
appreciate
Buba.
it.
We appreciate it. Thank you.
Thank you, sir. Jazakallah khairan.
Amen. Thank you. Mr. Abdul Hamid, thank you. Pharmacist Nembang, thank you. Pharmacist Zainab Sani, thank you. Aminu Target, we appreciate your participation. Hassaf, thank you. Daniel, thank you. Nos Hawa, thank you very much for coming and for your goodwill also. Thank you, and God bless. Thank you.
Thank you very much for your time.
Thank you very much. Thank you, Pharmacist Karen Sabun. Thank you very much. Regards to our colleagues at FMC. Thank you.
Thank you so much.
Thank you, ma'am.
Thank you, sir. Thank you, sir. Really appreciate it.
Pamaminu Mungode, thank you.
Thank you, sir. Thank you, sir. Really appreciate it.